Hey everybody, and welcome to the MMOA podcast brought to you by the Institute of Clinical Excellence. My name is Csepe. I'm coming to you from Colorado. Today we're going to be talking about fiber and its importance for our patients. Now, I know we are a very educated and somewhat invasive bunch when it comes to telling our patients what to do. And I certainly don't want to add another thing that you have to feel responsible for in regards to communicating to your patients regarding their health. But the evidence that fiber can help us not only decrease cancer risk and help our patients feel better is overwhelming. First, if I can start with an anecdotal story. My dad completely changed his life several years ago after having a colonoscopy and having it revealed to him that he had several polyps that put him at risk for cancer. He read the report and he totally changed his dietary routine, which he often referred to as the change before he realized that often referred to menopause in many women. My dad totally changed his diet. He substituted a lot of ultra-processed, high-starch, high-carbohydrate foods for whole foods and significantly increased his vegetable intake. And anecdotally, he reported significantly less pain throughout his joints, fewer headaches, and improved sleep. He had a lot of first finger arthritis, and when I'd sit next to him in church, he'd often struggle to move his finger and had no extension. And afterwards, he would say, "Ellen, look at this. Look at my finger. Look how much it can move." So this podcast is an homage to his change in his health and the evidence that supports the claims that he has. Number one reason for talking about fiber with your patients is that it significantly decreases cancer incidence, specifically in gastrointestinal conditions. So an increase in 10 grams of fiber per day decreases your risk by 10 to 13 of colorectal cancer. It decreases your risk gastric cancer by 44% lower risk. If you're a woman, 60% lower risk by increasing a high fiber diet. Ovarian cancer and lung cancer are overall decreased. All cancers combined causes with a higher fiber diet suggests a 10% lower risk overall of cancers. How does that work? Let's dork out for a minute. So fiber basically takes inflammation in our body and pulls it along your gastrointestinal tract and sucks it out and evicts it from your body. So that increase in gastric motility and expelling different potentially problematic components in our body decreases our cancer risk, which is important because we're seeing a significant rise in cancer, specifically colorectal cancer, among middle-aged and young adults. I treat a patient anecdotally who's an oncology nurse, and she says that the number of patients who are in our age group is staggering. I have a coworker whose classmate, who's 27 years old, was diagnosed with stage 4 colorectal cancer after having a sudden onset of left flank pain, which turned about to be a metastasis in her liver that was pressing on her rib cage. So important to note here that we can help decrease risk of disease in our patients by talking with them about fiber intake. And I would argue that there is no better clinician than the clinician that spends hours with a patient who's really a captive audience ready to change their health habits as they are when they're in our office. Number 2 reason to talk about fiber is overall high fiber diets moderately lower inflammation. So what we're understanding about pain, disease risk, and chronic inflammation is that it increases with age and it increases with chronic disease, and it can add this pinball spiral effect of increasing our patient's risk of disease over time, and we can do something about it. So, shameless plug, if you have access to the virtual ICE mentorship or online hour-long lectures that we provide as a company, I did advice on Inflammaging last season that really captured the science and understanding behind inflammation and aging. Basically, when your patients come to you and they say, man, I feel like crap, everything hurts, everything feels inflamed, I don't have any markers for rheumatoid arthritis or lupus or MS. Why does everything hurt? Is this what getting old feels like? Ellen of yesteryear would have thought, that's not what getting old feels like, because I know people who are old who don't feel like that. I now see that that's probably what inflammaging feels like, because over time, what we see is this increase in smoldering systemic inflammation measured by C-reactive protein, interleukin 6, and tumor necrosis factor alpha. So different blood markers, which your patients might already be getting tested for in their annual physicals, show that that inflammation has gradually increased. And they feel sick, their joints hurt, they feel fatigued, they're at higher risk of cardiovascular disease, diabetes, and they're at higher risk for musculoskeletal pain. They hurt. But here's the good news. Instead of just looking at your patient and saying, well, that sucks, sorry that you feel so bad, maybe you can take some ibuprofen for your chronic inflammation, we have several other very impactful interventions that we can provide to our patients, one of which is advocating for a high fiber diet. So here's the take home, that fiber decreases our inflammation. If you have a patient sitting in front of you and they say, wow, I literally had this conversation today with a patient that, man, I feel kind of crummy after a weekend hanging out with my friend. Hey, that's okay. Glad you had a great time. But there's a chance that less sleep, higher alcohol intake, and less healthy foods are contributing to how you feel. Great news, higher fiber diets can decrease that flame on your inflammation. So, some important takeaway here is that we see decrease in our inflammation in most markers. There's a moderate impact of higher fiber diets on those markers. But we see the biggest improvement in those markers in patients who are really sick. So we see benefits are bigger and more evident in people that have obesity, diabetes, chronic kidney disease, rheumatoid arthritis, or higher baseline CRP. So, important takeaway here is that if you have a patient who has chronic illness, they are likely the most to benefit from high fiber foods. So, what are the recommendations for fiber? So, generally 25 grams of fiber per day for women, up to 35 depending on the size of the person, but generally males are bigger than females and require more fiber. So, 25 to 35. That number takes attention to get, I'll be totally honest. And it's a little bit confusing. When we talk with patients about protein intake, it makes sense that certain foods have more protein than others. Meat has more protein than grains. That's a no-brainer. And we know the higher the fat content, the lower the protein content. So think about shrimp. Way more protein than bacon, which has a lot of fat. Both of them come from animals, but shrimp has way less fat than bacon and has higher protein content bite for bite. Fiber is a little bit persnickety. It takes attention because foods like fruit, watermelon, has barely any fiber, but fruits like berries have tons of fiber. Another interesting fact, avocados have a lot of fiber in them. Squash, which I would say, okay, it's kind of like similar consistency, not nearly as much. So it takes attention to get enough fiber, and a variety of fruits and vegetables can add a compounding effect on decreasing our inflammation. So having a variety of fruits, vegetables, nuts, and seeds and whole grains can increase not only our fiber, but our gut diversity and decrease that risk for colorectal cancer even more. So when talking with your patients about fiber, shooting for 25 grams, potentially asking them to fill a log. What are some of the high fiber foods that you like to eat already that might already be in your diet? Do you like avocados and berries? Are you an oatmeal kind of person? Those are great sources to start with and might be more important to include as staples in your diet. If getting enough fiber is really a challenge for patients, there's a huge expansion in fiber candy and fiber supplementation. Metamucil is not just for seniors anymore. We have fiber candy. Starburst, the candy company, has goodies. So what they're called is Starburst goodies, and they have about half of your daily fiber needs in one package. Fiber basically can't get absorbed into your body as a nutritional source. So if you have a patient who's looking to decrease their body weight or address their overall gut motility, fiber can be another really great addition to their diet because it helps keep you fuller for longer without actually adding net calories to your plate. So fiber is a super important overall backbone of our diets, and we're seeing a lot of patients who aren't getting nearly enough fiber in their day. So I know that the experience that my dad had with fiber could be anecdotal, and you might not have significant range of motion that you're showing off in church pews, but fiber is an important way to decrease our overall risk of disease, decrease our inflammation, and help us feel better. Thank you for joining me tonight, and I hope you have a great bowl of oatmeal before we see each other.